Hi there. My name is Joan McEachran. I'm a volunteer at the Sexual Assault Centre Kingston. I work as both a crisis line volunteer, a facilitator for the crisis line, so kind of stepping in to help back up volunteers when our volunteer coordinator is off. And I also have volunteered as an accompaniment volunteer. So through my experience as a volunteer, the myriad of services that are available through the Sexual Assault Centre of Kingston have been, very essential to the community. Need has been very high in Kingston. There's an outrageous rate of sexual violence within our community, but also through the pandemic, people have been very isolated and cut off from their normal support and coping, mechanisms and structures. So the crisis line and the counseling has been very essential to those who have had their lives so disrupted and have had difficulty readjusting, especially from the perspective of a survivor. So for crisis and support services, there's the 24/7 crisis line, as well as our text and chat line, which currently functions about 12 hours a day, both of which are run by volunteers, which are trained crisis volunteers. And both services provide confidential, non-judgmental support to survivors. A lot of our calls are quite varied. Most can be typically mental health crisis intervention or support. Sometimes it's just chatting, and sometimes it's also resource referral. So helping them find the information they need about how to report, what funding is available for them if they've incurred damages, helping them navigate the legal system, or connecting them with counseling. So we're very lucky to have counseling at the Sexual Assault Center and very thankful for it. The counselors are all great and we're able to refer directly to them. So if we have someone call and we can set them up with the contact information for our intake coordinator. And counseling at the center is provided by our very well trained counselors who use a myriad of techniques and modalities to tailor therapy to the individual to make sure to meet their needs. We also have individual and group counseling, which is great to have options for survivors depending on what their preference is. We're also very lucky to have an Indigenous counselor to support self-identifying Indigenous survivors, which is a really great service to offer in our area. We are also very happy to have launched Vesta this year. So Vesta is a tool that I've referred to a few times to people on the line. It's an anonymous reporting tool where survivors, it's self-paced, so survivors can walk through it at their own pace and fill out information based on what they're capable of doing or want to do at that time. It's locked away from Vesta or anyone else until they're ready to submit it. And if they do submit, it just goes into a database. It's not a police report, but it's a great tool that I know some survivors have used to prepare for police reporting as kind of a safe space for them to process their encounter with some prompts that also allows them the safety to remove themselves from that report if they need to. We also do accompaniments. So I have been on a few of those as well. And unfortunately, they've been not happening because of the pandemic, but just restarted this year. So I'm happy that those have been able to be opened up again. And accompaniments, we go to medical appointments or to legal appointments with survivors. Sometimes the requests come through the crisis line directly, and sometimes they come from counselors on behalf of their clients. So it's a great resource to have attached to the center because then counselors can just directly ask the volunteer coordinator and quickly get it set up rather than needing to navigate a kind of maze of different organizations. And accompaniments typically can just be, moral support. Sometimes we're there, though, to also advocate for the survivor and ensure that they have a due process and safe process when they're reporting or reporting to the hospital for medical care. So all these services are essential, all tied together. And I can't imagine Kingston without it. The need has been so high, and I'm very thankful that the center is here, and I'm thankful that we have the funds to support all these wonderful services and the individuals behind them. So thank you for listening and thank you for your support.